Come in.
Good evening, Dr. Ullman. My name is Danielle Ullman, and today we're going to be doing a full head-to-toe physical exam. If you have any questions during the exam, just stop me and we can answer questions, okay?
Okay.
All right, so we're going to start with inspecting and palpating your skin. I'm just looking at the color. It is symmetric. You appear to be in good hygiene. As far as lesions go, you do have a couple on your face that I'm going to measure. There are macules. It looks like they are all less than 1 centimeter. In a random pattern, I'm not seeing any irregularities with them, anything to be concerned about. I'm also seeing some random macules on your arms and legs. Do you have any new moles that you're concerned about?
Nope.
Okay. And I'm not seeing any elevation or depression, no exudate coming out of them. And like I said, the distribution is just random. It seems like those are normal moles that you've had. I'm not seeing any, smelling any odors. I'm not seeing any moisture on your skin. As far as temperature goes, arms are both warm, as well as legs and feet, uniform in temperature. I'm just going to check your skin turgor. Good. Good skin turgor, and skin is elastic. Next, I'm going to just inspect your hair. I'm looking at the color. It's brown. There are some gray pieces mixed throughout. Texture is smooth, and the hair is straight. All right, and then I'm going to look at your nails next. So they are well manicured, rounded edges. I'm not seeing any thickening or thinning of the nails. They appear to be attached to the nail beds. Can I see this one as well? Good. Seeing the same on this side. And then I'm just looking at your cuticles. Cuticles appear to be normal. Vasculature also appears to be normal. I'm just checking your capillary refill. Good. And it is less than 2 seconds on both sides, which is normal. All right, next I'm going to palpate your scalp. I'm not feeling any lesions, no trauma. Any pain with palpation?
No.
Good, and it feels uniform, and I'm not seeing any flaking or any lesions in the scalp. All right. So now we're going to look at your face. It appears symmetric. Pigmentation appears normal. I'm not seeing any abnormal facies or tics. And then I just want to palpate your frontal sinuses. Is there any pain with this palpation?
No.
Is there any pain down here?
No.
Good. So those frontal and maxillary sinuses appear to be normal. As we said, the scalp is symmetric. I am seeing a receding hairline in the front of your scalp. Sutures appear to be intact and normal. No fontanelles are open at this point. Hair texture is soft. Color and distribution are normal with a little bit of receding hairline and thinning in the top of the head. So now we're going to move on to the neck exam. First, I'm just looking at your neck, and it appears symmetric. I'm not seeing any bulging muscles, any webbing. I'm just going to palpate where your trachea is. Good, and that is midline. Not seeing any tugging. I'm going to come behind. I just want to palpate the hyoid. Good, can you swallow for me? Good, and there's movement on swallowing, and I'm also palpating the thyroid while I'm back here. Good, size is normal, shape appears to be normal. I'm not feeling any enlargement, any nodules, anything like that, which is good. Was there any tenderness when I was palpating? Perfect. Okay, so now we're going to palpate some lymph nodes. So, posterior auricular, preauricular, occipital in the back, sternocleidomastoid is here, submandibular, submental, anterior deep cervical, posterior cervical, and then supraclavicular. I'm not feeling any enlarged lymph nodes. Was there any pain with that palpation?
No.
Perfect. All right, so now I'm going to auscultate some arteries with my stethoscope, just listening to hear if I hear any abnormal sounds. All right, so we're going to start with the temporal. Good. And then I'm just auscultating over your eyes. If you can just keep those closed for me. And then finally over your thyroid. Good, and no bruise are present. Next, we're going to palpate this joint right here. Can you open your mouth for me? Good, and close it. Good, no crepitus. Was there any pain with that?
No.
Perfect. All right, so now we're going to move on to the vision testing. So I'm going to have you cover one of your eyes and read the lowest line that you can for me.
Okay. 428739.
Perfect. Can you do the same with the other eye?
428739.
Perfect, and that is 20/20 vision. Next, we're going to check your confrontation. So you're going to see my fingers moving towards you. I just want you to tell me when you see them, okay?
Okay. Now. Now. Now.
Okay. So confrontation is intact as well. So peripheral vision looks good. Now I'm just going to look at your eyes. I'm looking at your eyes and your eyebrows, just seeing if I see any abnormalities, any swelling, anything in the orbital area going on. I'm not seeing any drooping eyelids, no fasciculations, tremors, flakiness, anything like that. I'm also looking at the conjunctiva and sclera, and they also appear to be normal. Cornea looks clear. I'm not seeing an arcus. The color of your irises are brown. I want to check your pupil response to light. Okay. I just want you to look straight ahead. Good. Direct and consensual response to light is intact in both eyes, which is normal. Lacrimal glands appear to be intact. I'm not seeing any drainage, any swelling, anything like that. Next, I'm going to check your extraocular motions. So I am going to have you follow my finger, okay? Good. So all cardinal directions, eye muscles are intact, which is normal. Next, I want you to cover one of your eyes for me. You can pick which one to start with. Good. And now I want you to uncover. Good. Can you do the same with the other eye? And now uncover. Good. Eyes are aligned. Now I want you to look at the wall ahead of you. And then I want you to focus on me. Good. Accommodation is also intact. Next, we're going to move on to the ophthalmic exam. All right. Okay. Red reflex. And now I'm coming in. Look at those vessels. Perfect. Veins bigger than arteries, which is what I would expect. Optic disc. Perfect. Okay, now I want to look at the other side as well. Sorry, I know this isn't a fun one. Red reflex. Vessels. Perfect. Again, I'm seeing those veins and arteries again. Good. Everything appears to be intact. I'm not seeing any abnormalities, no cotton wool spotting or anything like that. So next, we're going to move on to check your hearing. First, I'm going to palpate your external ears. Is there any pain? Not feeling any masses. They are symmetric. I'm not seeing any color changes. No lesions. Next, I want to move on and examine your ear canals. All right. Canals are intact. I'm seeing a little bit of scant cerumen, but nothing of impaction or anything like that. Tympanic membrane is intact. I'm not seeing any bulging. Bones are intact. Same on this side. Okay. Again, just a scant amount of cerumen. I am seeing the tympanic membrane does not appear to be bulging. Incus umbo are visualized. Good. Canal appears to be normal in color. Not seeing any concerning changes there. Alright, so next we're going to check your hearing. So in order to do that, I'm going to have you close your eyes and you're just going to tell me which side you hear me rubbing my fingers on, okay?
Okay. Left. Both.
Yep.
Right.
Perfect. Hearing is intact. Now we're going to do the Weber test. I'm just going to put the tuning fork in the middle of your head and you tell me which side you hear it more on.
It's pretty equal.
Perfect, and that is normal. Next, I'm going to put the tuning fork right here. Once you can no longer hear it, I'm going to move it to here. And you're going to tell me if you still hear it.
No. Yes.
Perfect. And we're going to do the same on this side.
No. Yes.
And that is normal, so I'm not seeing any hearing loss present. Finally, we're going to do the whisper test. So can you cover one of your ears with me? Okay. And you tell me the word that I'm whispering.
Baseball.
Good. And then cover the other ear.
Television.
Perfect. You were able to hear both words correctly. Next, we're moving on to the nose. I'm just going to inspect the nose. I'm not seeing any deformities, any changes on the outside of the nose. I'm just going to palpate it. Feels midline. Any pain with palpation?
No.
Okay. I'm not seeing any displacement. There's no tenderness, no masses. Can you breathe in for me? Good. Can you do the same on the other side? Good.
For what it's worth, I hear a dog.
Both nares are intact. Now I just want to look inside your nose. All right, septum is midline. I'm not seeing any perforation, not seeing any swelling. Nothing is draining out of your nose right now. And then again, at this point, we could also palpate the frontal and maxillary sinuses, which we did previously, and there was no pain with that. Next, we're going to move on to the mouth and throat. So first, I'm looking at the lips for the color. Color is normal. I'm not seeing any cyanosis or anything like that. Symmetric. I'm not seeing any chapping, any edema. So next, I want to look at your teeth. Can you open your mouth for me? Good. I'm not seeing any abnormalities on the front. Can you open? Good. I'm not seeing any caries. Do you have any loose or missing teeth that you're concerned about? Perfect. And then next I want to look at your tongue. You stare at your tongue for me. Good. Color is normal. I'm not seeing any lesions. No swelling, ulcerations. And then can I also look at the inside? I want to see your cheeks. Again, no ulcerations. Color is pink and it is intact. So buccal mucosa looks good. And then uvula and palate. Can you open your mouth for me and say ah?
Ah.
Good. Symmetric movement of the palate. Uvula. And then tonsils are present. Posterior pharynx, I did not see any abnormalities. So next we're going to move on to inspecting the precordium. So for this, I'm going to have you lay down for me. And I'm just going to have you put your shirt up for me. And then I'm just going to look with tangential lighting. And I'm not seeing any pulsations. Okay. Just going to look at the landmarks. So the apex of your heart, and then sternal borders, and your sternum. And as I said, I'm not seeing any pulsations, and I'm just going to feel right here to see if I feel any heaves or lifts. Good. Can you roll onto your left side for me? Perfect. And I have my hand in that same place at the apex, just trying to feel that PMI. Perfect. Okay, you can lay flat for me again. All right, so now we're going to move on to some auscultation. I'm going to use the diaphragm of my stethoscope and we're going to auscultate some valves. So second intercostal, aortic. Bless you. Pulmonic, second on the left. Herbs point, third. Tricuspid, fourth. And mitral, fifth. And the midclavicular line. Perfect. And now can you hold your breath for me? We're going to listen to those same areas. Good. Perfect. And I'm not hearing any differences, any splitting, anything like that with your respirations. Next, I'm going to listen with the bell in those same areas. So aortic, second right, pulmonic, second left, herbs point, tricuspid, fourth left, and then mitral, fifth midclavicular. Perfect. I'm not hearing any murmurs present, which is normal. Next, we're going to move on to inspecting and palpating the chest. So first, I'm just going to feel that trachea again, like I said, midline, and then the notch, which is right here, and then lower than that, the angle of Louis. Okay, now I'm looking at the chest. Size is normal, shape appears normal. Interior posterior diameter is normal. I'm not seeing any barrel chesting. No prominent ribs, no retractions, anything like that present. Respiratory rate and rhythm appear to be normal. Respiratory rate of about 16. Chest movement is symmetric, and I'm not seeing any accessory muscles used. Okay. Next, I'm going to listen to the front of your chest. All right, every time I move my stethoscope, I just want you to take a breath. Good. And I'm not hearing any accessory sounds, no wheezes, rhonchi, crackles, anything like that, which is normal. And I just want to palpate your anterior chest just for any crepitus, which I'm not feeling. Good. And then I just want you to say 99 for me.
99. 99. 99.
Good. Tactile crepitus is normal. And then I just want you to whisper 1, 2, 3. Perfect. And that sounds the same everywhere, which is normal. All right, now I want you to sit up for me, and we're going to do the same kind of thing on that posterior chest. All right. So we're going to start by just listening. And as you cross your arms for me in front of you, yep, perfect. And then just take a breath every time I move my stethoscope. Good. And again, I'm not hearing any abnormal sounds, no wheezes, rhonchi, crackles, anything like that. I'm just going to measure your thoracic expansion. Can you take a breath for me? Good. Symmetric, which is normal as we would expect. Next, I'm going to measure your diaphragmatic excursion. So first, I want you to take a breath for me and hold it. Okay, and let that breath out. Okay, it's about 3 centimeters. Can you take that breath and hold it again? And again, about 3.5 centimeters. So it's equal on both sides. And then again, we're not hearing any extra breath sounds. And then can you say 99 for me again?
99, 99, 99.
Perfect. And then I just want you to do the same thing with the whispering 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1,
Perfect, and that is symmetric as well. All right. Okay, and now we are going to move on to your abdomen, so you can lay down again. And just put that shirt up for me again. Perfect. Okay. So first I'm looking at the skin of your abdomen. Normal color. I'm not seeing any abnormal vasculature popping out or anything like that. And your stomach is moving with your respirations, which is normal. Can you take your head and lift it up towards your chest? Good. You can put it back down. And I'm not seeing any masses, herniation, muscle separation as you're doing that motion. All right, so next we're gonna auscultate some quadrants. We're gonna start with the right lower. Just listening for bowel sounds. Bowel sounds are heard in all 4 quadrants. Next, we're going to move on. We're going to auscultate some arteries for bruits. We're going to start with your carotid and your neck. And I'm going to have you hold your breath as I place my stethoscope. So can you turn your head to the side? Perfect. Good. You can take a breath, and then can I see that other side? And hold your breath again. Perfect. Not hearing any bruise there. Next, we're moving on to the aorta. And then renal arteries. Iliac. And then femoral would be in the groin, and I would lift the pants if this was a patient physical exam. Perfect. And I'm not hearing any abnormal sounds in any of those arteries, again, which is normal. Next, we're going to percuss in all those quadrants. Good. And then I'm going to estimate the span of your liver. So that's about 7 centimeters. All right, and then I'm also going to percuss over the area of your spleen just to see if I can hear an area of dullness. Good, which we do. And then right in this area to see if I can find the gastric air bubble. Good. All right. So next I'm just going to palpate all 4 quadrants lightly. Let me know if there's any pain. Any pain?
No.
And I'm not feeling any masses, anything abnormal with the musculature. Next I'm going to feel a little more deeply. This is your umbilical area. Any pain?
No.
Okay. I'm not feeling any masses, anything like that. Can you take a breath for me? And let it out. Good. And then we're going to do the same on this side. Can you take a breath for me? And let it out. Good. And I'm just going to try to feel those kidneys, which I do not feel Not feel. So I could palpate the edge of your liver. Your spleen was non-palpable, which again can be normal. And then finally, I'm going to have you sit up for me, and I'm just going to so just touch some areas on your back. So just tell me if there's any tenderness in this area.
No.
Good. No CVA tenderness is present. All right. So next we're going to move on to the artery and vein exam. So we're going to begin by, can you face towards me? Okay. So I'm just going to feel your radial pulses. Good. Ulnar pulses. And brachial. Good, and those are all symmetric, equal, 2+ pulses. I'm going to have you lay back for me again so that I can feel your popliteal pulses. Just going to bend that a little bit. Okay. Good. And your posterior tibial pulses. Good, and again, those are equal, strong, and then dorsalis pedis. Good. And then your femoral pulses would be in your groin right here as well. Again, equal, 2+, regular rate. And then at this point, we could auscultate those abdominal arteries that we already did, the carotid, plus the carotid, plus the abdominal aorta, renal, iliac, femoral, but we already did that. And we said no buries were present. Next, I'm going to look at your jugular vein, just see if I see any pulsation. Good, and I can see that pulsation. Next, I'm just looking for sufficiency. I'm looking at the color of your skin, which is normal. I'm not seeing any cyanosis. No muscle atrophy. Any pain?
No.
Okay. And I'm not seeing any edema in the arms. Any pain?
No.
I'll just check and make sure you don't have any ankle edema. Yeah. No edema present. As we said earlier, extremities are all warm. No tenderness was present on palpation. No pitting edema is present. Next, we're going to move on to the mental status exam, so you can sit back up again for me, sir. All right, can you start by telling me the year, month, day, and season?
It is December 7th, 2022. It is winter time.
Good. What country are we in?
USA.
What city?
Gaithersburg, Maryland.
Perfect. I'm going to give you 3 objects to remember.
Okay.
Apple, pen, table.
Apple, pen, table.
Okay, and I'm going to ask you those later, okay?
Okay.
So I want you to start at 100, and I want you to subtract 7 until I tell you to stop.
Okay. 100, 93, 86, 79, 72, 65.
Perfect.
50.
You can stop. Okay, so now I want you to name this object for me.
Paperclip.
Perfect. And this object?
It's a screw.
Perfect. And then next, I want you to repeat no ifs, ands, or buts.
No ifs, ands, or buts.
All right, and next I want you to follow this command. I want you to take this paper in your right hand, fold it in half, and place it beside you. Perfect. And then I want you to follow this written command. Perfect. Close your eyes. And next, I will have you write a sentence. Any sentence you want, just has to have a subject and a verb. Perfect.
Oh, it's short and sweet.
All right, now I want you to copy those pentagons. Perfect. Can you tell me how an apple and a pear are similar?
They're both fruits.
Perfect. Explain the saying, the grass is always greener on the other side.
Scenarios can look better when you're not in them, but they're probably the same.
Perfect. And then what would you do if your house was on fire?
Get out.
Perfect.
Call 911.
So analogy, abstract thinking, and judgment are all intact. What did you have for dinner last night?
Applebee's.
Perfect. What road did you live on as a child?
Brant Drive, then Mitchell Avenue.
And then what were those 3 objects we talked about earlier?
Apple, pen, table.
Perfect. All right, and then during the exam you were alert, normal emotional effect, oriented, writing and motor were intact, your memory is intact, attention was intact, your voice is normal, quality, pace, volume, no signs of aphasia, articulation was intact, comprehension was intact, coherence intact. Can you tell me how you're feeling today?
Fine. Normal.
No changes in your mood lately?
Mm-mm.
Okay. Thought process is logical. And then have you been seeing or hearing things that other people don't see or hear?
Just a dog barking, but I think that's real. So no.
All right, no hallucinations. Next, we're going to move on to cranial nerves. So we're going to begin with olfactory. Can you tell me what you smell?
Listerine.
Perfect. Intact. Optic, visual acuity we already tested. So it was intact, 20/20 vision in both eyes. We already tested 3, 4, 5, oculomotor, trochlear, and abducens. When we did the 6 cardinal directions, those were intact. Next, we're going to move on to trigeminal. So we're going to start with sensation. This is sharp. This is soft. Okay? I want you to just tell me what you feel.
Sharp. Soft. Soft. Sharp. Sharp.
Perfect. Sensation is intact. You can open your eyes again. Can you just clench your jaw for me? Perfect. Motor is intact. Facial, we're going to test by moving your face. Can you lift your eyebrows for me? Good. Close your eyes really tight. Can you smile for me? Good. And then puff out your cheeks. Perfect. Intact. And then we already tested vestibular cochlear. When we tested your hearing earlier, it was intact. No conductive or sensory neural hearing loss was present. Next, we're going to do glossopharyngeal and vagus. You open your mouth for me and say, ah.
Ah.
Perfect. Symmetric movement. You could also do the gag reflex at this time, which we will defer. Next, we're going to test spinal accessory. Can you shrug your shoulders? Good. And then can you turn your head against my hand? Perfect. Intact. And then we're going to do hypoglossal. Can you stick out your tongue for me? Good. And then move from side to side. Good. Perfect. Hypoglossal is also intact. Next, we're going to do the cerebellar function and proprioception. So we're going to start by doing rapid motions. You're going to place your palms there and just move back and forth. Perfect. You can stop. And next, I want you to touch your nose and then touch my finger. Okay, perfect. Next, we're gonna test your balance. Can you stand up for me? Good, with your feet together and close your eyes. Perfect. And then can you lift up one of your legs and stand on one foot? Perfect. Okay, now you can stop. Balance is intact. I'm gonna have you walk for me regularly. Gait appears to be normal that way, and then I want you to turn around and walk heel to toe. Good. And then I'll have you turn around again and walk on your heels. Good, and then walk on your toes. Perfect. All right, you can sit back down. Okay, so gait appears to be normal rhythm, sequence and stride, arm movement, all normal. Now we're going to do the sensory response to superficial touch. So I'm just gonna have you close your eyes again, and I'm gonna touch your extremities, and you'll tell me where I'm touching.
Okay.
And if it's soft or sharp.
Soft left forearm. Sharp right upper arm. Sharp right thigh. A soft left lower leg. Soft left neck. Sharp left neck.
Sorry, that's fine.
Sharp right foot.
Perfect. So sensory response to touch and pain is intact. Next, we're gonna do the position sense. We'll start with your fingers. So you're gonna keep your eyes closed, and then this is up, this is neutral, this is down. Okay.
Up. Neutral.
Okay. Same on this other hand. Up, neutral, down.
Down. Up.
Perfect. Okay, I'm gonna do the same with your toes. So up, neutral, down. Okay.
Yep. Up. Neutral.
Good. Same on the other side. Okay. Up, neutral, down.
Down. Up.
Perfect. So position sense is intact. Next, we're gonna do 2-point discrimination. So you're gonna tell me if there's two, if you feel 2 pinpricks or 1.
Okay. 2. 1. 1. 2. 2.
Perfect. 2-point discrimination is also intact. Okay, next you're gonna keep your eyes closed again, and I need to see that palm. I'm gonna write a letter, and you tell me what letter it is.
B.
Perfect. I'm gonna place an object in your hand, and you're gonna tell me what it is.
Paperclip.
Perfect. And then we already did the identify to. Okay, so now I'm gonna touch you with my hands, and you're gonna tell me what part I'm touching with your eyes closed as well.
Right neck. Left knee. Right foot. Right lateral thigh.
Perfect. So you can identify body areas that are touched. Next, we're gonna do some reflexes. I'm gonna have you just lay back for me for a second right there. Okay. Perfect. The muscles are contracting when I'm touching, which is normal. I'm just gonna check your ankles for clonus first. Good. Okay, no clonus present. Now I'm gonna do your Achilles reflex. Good. Okay, can you sit up for me and we'll do the patellar reflex?
You want Babinski?
Oh. Yeah, I should do that while I'm down here. Okay. Oh, Babinski response. And then let's do your patellar. Good. Good. Alright. Next, act like you're holding a cup. Okay. Same on this side. That's brachioradialis. Okay. And we'll do the biceps. Good. And then tricep. Good. All the reflexes are intact. Next, we're going to move on to the musculoskeletal exam. So we're going to start by looking at all the extremities. We're comparing sides. Muscles appear to be symmetric. Alignment appears to be normal. I'm not seeing any deformities. The skin appears to be intact. I'm not seeing any abnormalities over any of your joints, no swelling, anything like that. I'm not seeing any muscle fasciculations. Again, the muscles are symmetric. No spasms are present. We're just going to palpate, especially over those joints. Let me know if there's any pain.
No.
Any pain in your hands,
Mm-hmm.
in your knees, or in your feet. Okay. Good. And again, you are warm. No tenderness is present. No swelling, crepitus, anything like that. So we're going to compare some muscle groups now. We're going to start with the hands. So first, I'm going to just move the joints a little bit. Any pain when I'm moving them?
Mm-hmm.
Okay. I'm going to have you move your hands for me. Good. And like from the other part. Good. Okay. Oh, you're doing wrists too? Okay. Perfect. All right. Now I'm going to have you hold your fingers together. Don't let me pull them apart. Good. Same on this side. Good. Okay. Now put them apart. Yep, don't let me put them together. Perfect. Don't let me put them together. Good. Alright, and then squeeze my fingers. Good. Okay. Now I'm going to have you put your wrists out and then try to push up on your wrists. Good. And then try to push my hands down. Good. Okay. Next we're going to move on to elbow. Any pain?
No.
Okay. Now can you move your elbows for me? Good. Alright. Now try to push them together, like up. Push up. Good. Okay, and then try to push down. Good. Okay, next I'm going to move on moving your shoulder. Any pain with this?
No.
Okay. So I move the other side as well. Any pain with any of this?
No.
Okay. Can you move your shoulders for me?
Yep.
Good. Alright, can you lift them up for me? Hold them out. Don't let me push them down. Good. And then try to put them down. Good. Alright, next we're going to move on to your temporomandibular joint. So can you clench your jaw for me? Good. Okay, don't let me pull it open. Good. Now open it. Don't let me push it shut. Good. Okay, and next we're going to move on to your cervical spine. I'm going to start by just feeling it. Okay, and then I want you to move your neck. Touch your ear to your neck and then move just in a circle. Yep. Any pain with those movements?
No.
Okay. Good. And then can you put your ear down to your... Good. Okay. Now same on this side. Put your... Good. Okay. And then push down. Good. Push back. Good. Okay. Next, I'm going to move on to your lumbar and thoracic. Can you stand up for me? Just going to look. Back appears aligned. Any tenderness?
No.
Okay, can you bend over for me? Good. Okay, back appears normal. I'm not seeing any curvature. Okay, good. You can stand back up for me. And you can sit down, actually. You can lay down. All right. Okay. So, next we're going to move on to your hip. I'm just going to move that hip. Let me know if there's any pain. Any pain with that?
No.
Okay, same on this side. Any pain?
No.
Okay, can you move your hips for me? Same with the other side. Okay. Alright, now I'm going to have you try to push up with your hip like you were. Push up against my hand. Good. And then, okay. Now push down. Good. Same on this side. Good. Now down. Good. Alright, now we're moving on to that knee. Any pain with this?
No.
Good. And then can you move your knees for me? Okay. Now with that knee up, can you bend it again? Good. Now try to push out. Good. Now try to pull back. Good. Same on this side. Can you bend it for me? Push towards me. Good. Pull back. Good. Okay. Now we're going to move on to those ankles. Can you move your ankles for me?
Yep.
Good. Okay. Can you push down? Good. Pull back. Good. Alright. And now can you curl your toes for me? Good. And push them up towards the sky. Perfect. And then don't let me separate them. Okay. Okay. And then I'm just looking at your alignment of your ankles and feet with your tibias. Appear to be normal alignment. I'm not seeing any edema, any abnormalities. And then I want you to stand up for me one more time. And I just want to look at the alignment. Again, I'm not seeing any abnormalities with that alignment. Everything appears to be normal. So with that, I think we're done with this exam. Thank you and have a good day.
Thanks.